Almost all urologists needs to work in a radiation environment to perform an endurological surgery. It is inevitable to avoid these radiation exposures for physicians, or staff, and patients. Radiation exposure of digital X-ray is 15 times higher compared to fluoroscopy. And CT scan is 150 times higher when compared to fluoroscopic radiation exposure. While ultrasound and magnetic resonance imaging have zero radiation exposure. These infographics will explain how radiation can adversely affect your body. Once the X-ray is released from the X-ray tube, some scattered radiation is reflected from the objects in the X-ray path before it hits the detector. The objects can be a patient table, patient, instruments, etc. The human body absorbs this scattered radiation. Once absorbed by the human body, scattered radiation triggers cellular or atomic level changes, leading to disharmonizing of the cell's nuclear structure. This damage to atomic structure in the cells leads to unstable electrons and damaged DNA. Once the cell's DNA is damaged, the body's defense mechanism attempts to repair the cell. During the attempt to repair the cell, cellular death often occurs. Too many cellular deaths lead to general feelings of malaise and fatigue. During the attempt to repair the cell, it can often happen that cells may mutate, and such mutation can lead to uncontrolled cell growth, which may lead to cancer development. To minimize the unwanted adverse effect of radiation, the ALARA principles should be followed. These principles are: limit the radiation time. Maintain adequate distance from the active radiation course. Equip yourself and your staff with proper radiation protective gear.